So there are three modalities which we generally use for breast screening, and they are the mammogram or the digital mammogram, the ultrasound and the MRI. Of these three modalities, the one that we use most commonly is the digital mammogram, which has been in use for many years. So this digital mammogram involves compression of the breast, and also it can pick up microcalcification, which is an early sign of breast cancer. But I find that with digital mammogram, patients usually complain of pain because we are having breast compression to have a better look at the breast tissue. Ultrasound is another modality which we use for breast screening, which is of course painless as compared to digital mammogram and can be used in all age groups, while digital mammogram, because it involves radiation and X-ray exposure to the patient, we usually generally tell the patients to take mammogram only after 40 years of age. Ultrasound, on the other hand, can be used in all age groups and there is no radiation or any hazard to the patient. But we have little limitations with ultrasound also, which include we cannot find out microcalcifications usually by ultrasound. The third modality is MRI or magnetic resonance imaging, which is currently quite an expensive technique in India and not all people can afford it. Patients in India usually present at a late advanced stage of cancer, which means we cannot cure them of the breast cancer disease. So we currently need a breast screening program to detect early cancers in these patients so that we can cure them of the disease the earlier we detect them. Thermography as a breast screening technique, and a lot of research has gone into the product. Thermography actually detects the temperature of the breast without any compression or any pain to the patient. So it is patient friendly. I have been associated with Illumina 360 and I have done screening on about more than 1,500 patients using this thermography technique. And I find that sometimes the thermographic picks up the heat in the tissue even before the appearance of the cyst or any inflammatory changes in the breast. So I find that if this technique can be followed up for more years, we may pick up early breast cancer also as days go by. So once a thermographic abnormality is found out, we have to necessarily do an ultrasound to locate the lesion and then decide how to go about managing the patient. So I've been associated with this technique and I find that the new modality which is being used now gives added advantage because we are also using the cooling breast technique and taking the thermographic patterns both before and after cooling. And I think it should be advised as a screening modality, especially for younger patients who cannot be exposed to digital mammogram due to the radiation exposure, and it can be backed up by ultrasound or digital mammogram as the radiologist sees fit. The thermography as a breast screening technique. So I've been associated with this technique and I find that the new modality which is being used now gives added advantage because we are also using the cooling breast technique and taking the thermographic patterns both before and after cooling. And I think it should be advised as a screening modality, especially for younger patients who cannot be exposed to digital mammogram due to the radiation exposure, and it can be backed up by ultrasound or digital mammogram as the radiologist sees fit. I find that women in India are not ready for coming for the breast screening programs. Mostly it is due to their hesitancy and embarrassment in coming for a breast cancer screening. And I find that also the male members of the family should encourage women to come and take for a breast screening program so that we can detect early cancer when it is curable. Because a breast cancer in a woman is a devastating finding because it affects the whole family rather than just the woman itself. So early screening is a must, and it would be good if the women itself become aware, come forward for screening, or the husbands encourage them, or their friends. Sometimes they come when their friends or family members have gone for a mammogram and then they say it's okay, it is good, you can take it. Then they are encouraged to come. So all these three aspects, if we tackle and make the women come for breast screening, then we can really pick up all these early breast cancers, which would be very good. Of late also I found a trend where cancers are picked up in younger women. In fact, I remember a patient of mine who came for a lump in the breast. She was just newly married about 1 month back, and we found out she had a big breast cancer and she had to have a big mastectomy or surgical removal of the breast and nodal clearance. So it is very devastating. This is just 1 month after marriage. So all these breast cancers, now I find they're coming in younger age group, and so this breast screening modality we need for younger age group also. In younger age group, digital mammogram is a little disadvantage because all the young women have dense breast, and dense breast is one of the bugbears of digital mammogram where we cannot pick up early cancer. So in these situations, in younger age group for a screening, I think thermography will have a good role, and if we find any abnormality on thermography, then we can go ahead with breast screening either with ultrasound or mammogram or even MRI if necessary to pick up the early lesions so that there is a cure for the patient, which is what we can do, because breast cancer is a curable disease if picked up early, which is really beneficial not only to the women but to the family at large.